Next question is from Charlie Angus, please.
Thank you, Mr. Chair, and thank you, Chief Day. Good to see you again. Thank you, Mr. Young, for being here. I want to look on two levels. One is at our committee, we are dealing with government and policy, so start there and then maybe go to the ground, what it looks like on the ground. You talked about not having any money in the fiscal tank to get what needs to be done. We visited Kashechewan and Attawapiskat last week with Minister Philpott, where she saw the Tylenol clinics, they call them, where we have no doctors, we don't have the proper medical services, we don't have the mental health workers, but there was $0 in the federal budget to add new money to either health or mental health services for Indigenous communities. What does that shortfall mean? What are you looking at in order to fill that fiscal tank?
Well, what I have today, Mr. Angus, and thank you for the question, is we're looking at the First Nation health crisis and specifically mental health. We feel that mental health should be a shared plan. First Nations are quite prepared to do this work. But as you indicated, one of the shortfalls in the 2016 budget was with respect to mental health and addictions. So what we've got here, Mr. Angus, is we've got a very brief plan, but what we spelled out are the types of investments that are required. You will require in the you will recall in the standing committee that we had on the NAN health emergency. You know, the government was faced with the issue as it's seen in the north. However, across the board, what we need across the country right now is $136 million increased annually to deal with mental health and addictions, and these are investments that should have been in the 2016 budget, but they weren't. So we've been very succinct and very clear about how to break up that investment, and that will be in the supplementary material.
Thank you. That's very helpful. We've been hearing a lot about the First Nations mental wellness continuum framework, but the government's told us at committee that there's only $350,000 in there. What do we need to make sure that we can do that, make full use of that?
Well, again, the overall ask here is $136 million. You know, that broken down across 633 First Nations across the country, you know, it just shows that even at $136 million, you know, it's a pretty conservative estimate. Like, we definitely need a lot more, but this is what we need immediately.
Thank you. Well, I think this is really helpful because I did get a Facebook message from a young woman in one of our northern communities. She said, I hear there's an emergency response team going to Attawapiskat. Could you drop a couple workers off in our community because we don't have any? So I want to go to on the ground. In 2009, we had a horrific suicide crisis in James Bay region, and Chief Jonathan Solomon has spoken eloquently of that. At that time, the provincial workers were laying off staff at Pea Catano because they had spent their budget because they were working around the clock trying to keep children alive. Then there was a big outcry, and then so the provincial government augmented, said they would hire new workers. 2012, nobody was paying attention, they laid them all off. 2014, I was in the communities, and we had children on suicide watch because there was no mental health workers, and the only tool that they had was to take the children into custody and put them into child welfare and foster care because they had no other tools to help these children, and so the children were going to ground. In 2016, we have another huge blow-up of a suicide crisis, and everybody's wringing their hands and saying, how did this happen? It seems to me that if we don't have the ongoing support on the ground to respond to young people when they need it, what we're seeing in northern Manitoba, Attawapiskat, Pikangikum, that's the result. You have the experience. Can you say what we need in terms of making sure that we're not having to respond in the middle of a crisis, that we're preventing crisis?
Right. That's a good question, Mr. Angus, and I want to refer back to what just took place in the Ontario region. The Premier Kathleen Wynne has been a champion of a number of issues as it pertains to the Aboriginal community and has a very direct relationship with First Nations in Ontario. And as such, as seen with the issues in Attawapiskat and in the north, you know, it was the provincial government that stepped up in most cases first. Recently, with the announcement of $220 million health investment in Ontario focused on the north where it's needed, one of the things that we need to be clear about here at the committee and sending back to the federal government is the Ontario government is saying, listen, we will put 6 new treatment centres in the province of Ontario for First Nations, but we need the federal government to finally come to bat. This is going to be required immediately. What we want to be able to do is we want to be able to make use of those investments in the Ontario region, for example, but we need the federal government to work with us on the capital side now. So I think it's safe to say that there's a lot of people doing a lot of work, and I think the federal government has said a lot of good things. They've made some promises and created high expectations. The provincial government has come to bat now, and I think we need the federal government to move on some of the other issues like capital for treatment centres.
Thank you. I want to close out on that because the fact that the provincial government stepped up in an area of federal jurisdiction with $220 million on the table, the need to get a comprehensive plan, treatment centres, the fact that we have no place to send young people out for treatment. We were told that by Health Canada that it would be utopian to meet the need of how many mental health wellness teams that they've got. They got 10 mental wellness teams now. We asked them, don't you need 80? And they said, well, it would be utopian to get there. They didn't seem to have a plan. What do you think we need to do in terms of closing that gap if the province is stepping in regions where we have serious mental health and health problems? What does the federal government have to do?
Well, I think we need to make the determination that action is needed now. We can't fall into this cyclical phenomenon of proactive disengagement. We can't keep talking to see no results. We definitely need the federal government to move. We need commitments now. We need to be able to see what the government's prepared to put forward in terms of those investments in values of dollars. And within this quarter, within the next fiscal year, we need action today.
Thank you both. Next question from Mike Bosio.